What happens if you drink baking soda water at night for 2 weeks? Have you ever wondered why some of the simplest health remedies are almost never talked about? It's strange, isn't it? Right there in your kitchen cabinet sits a basic ingredient, ordinary baking soda, that holds amazing health benefits that rarely make headlines. Here's the uncomfortable truth. There's simply no big money in simple, natural solutions. Big companies can't patent or profit much from something that costs less than $1 at any grocery store. When an inexpensive remedy like baking soda water can help with so many issues, from digestion problems to inflammation, joint pain, and even sleep troubles, you have to ask yourself, why isn't this common knowledge? The numbers are shocking. Over 350 million people worldwide suffer from inflammatory conditions like arthritis, digestive issues, and acid reflux. Millions more struggle with poor sleep, constant tiredness, or kidney problems. Could something as simple as baking soda water actually help with these issues? In this video, we're diving deep into the science-backed health benefits of drinking baking soda water at night. And some of these benefits might completely surprise you. But here's what makes this special. By the end, I'll show you exactly how to prepare baking soda water the right way, the safe amount to take, and how long to use it to start seeing real results. So don't skip ahead. Watch until the end because the way you use it makes all the difference. 1. Heartburn and acid reflux relief. Picture this. You're lying in bed trying to sleep when that familiar burning sensation starts creeping up your chest. If you've experienced heartburn or acid reflux, you know exactly how uncomfortable and disruptive it can be. This burning feeling happens when stomach acid flows back up into your esophagus, the tube connecting your mouth to your stomach. Your stomach has a special lining to protect it from acid, but your esophagus doesn't. That's why it burns so much when acid escapes upward. So how does baking soda help? It's actually quite simple. Sodium bicarbonate, the scientific name for baking soda, is naturally alkaline, meaning it neutralizes acids. When you drink a solution of baking soda and water, it quickly reacts with the excess stomach acid that's causing your discomfort, neutralizing it and providing fast relief. Researchers discovered that patients who consumed bicarbonate-rich mineral water experienced significant relief from heartburn symptoms compared to those given a placebo. Many people find that taking baking soda water about an hour before bed can prevent nighttime heartburn episodes altogether, leading to more restful sleep. The relief typically comes within minutes, much faster than many over-the-counter medications. However, it's important to note that while baking soda offers quick relief, it's not a long-term solution for chronic acid reflux. If you experience heartburn or acid reflux symptoms regularly, especially several times a week, you should consult with a healthcare professional. Persistent symptoms might indicate GERD, gastroesophageal reflux disease, or other underlying conditions that require proper medical treatment. 2. Muscle recovery. Ever finish a tough workout only to wake up the next day feeling like you can barely move? That familiar soreness has a scientific explanation, and baking soda might be the solution you never knew about. When you exercise intensely, your muscles produce hydrogen ions, creating an acidic environment inside your muscle tissues. This acidity is what contributes significantly to that burning sensation during exercise and the soreness that follows afterward. Your muscles literally become more acidic when you push them hard. Sodium bicarbonate, baking soda, works as a buffering agent in your body. By drinking it dissolved in water, it helps neutralize this excess acid, bringing your body back to a balanced pH state faster. Think of it like adding a neutralizer to an acidic solution in chemistry class. It helps restore balance. A compelling 2019 study published in Frontiers in Nutrition confirmed these benefits. Researchers found that sodium bicarbonate supplementation significantly improved recovery by restoring the body's acid-base balance after intense workouts. The participants who took sodium bicarbonate showed increased blood bicarbonate concentration and higher pH levels, creating a more favorable environment for muscles to recover. The study revealed something even more interesting. This wasn't just about reducing soreness. Taking baking soda water between exercise sessions actually prepared the body for better performance in subsequent workouts. Athletes could train harder and recover faster when using this simple remedy. 3. Kidney support. For people living with chronic kidney disease, CKD, nighttime offers a unique opportunity for healing and restoration. One common complication these patients face is metabolic acidosis, a condition where the kidneys can't remove enough acid from the body or hold on to enough base. This imbalance can actually speed up kidney function decline. This is where sodium bicarbonate steps in as a surprisingly effective support. By taking baking soda dissolved in water, especially before bed, patients can help correct this acid-base imbalance in their blood. A comprehensive 2021 meta-analysis published in Frontiers in Pharmacology examined multiple studies on this exact topic. The researchers analyzed data from patients with CKD who received sodium bicarbonate supplements. The results were remarkable. Patients showed significantly increased serum bicarbonate levels, a measure of alkalinity in the blood, and experienced a slower decline in estimated glomerular filtration rate, eGFR, which is the key indicator doctors use to track kidney function. Even more impressive, the study noted improvements in vascular endothelial function, how well the blood vessels work, which is particularly important since cardiovascular health is a major concern for kidney patients. For maximum benefit, taking baking soda water at night allows the body to work with these alkalizing effects during sleep, when the body naturally focuses on repair and restoration. The typical approach is 1/2 teaspoon dissolved in water before bed, but anyone with kidney issues should absolutely consult their doctor before starting this or any supplement. 4. Gout relief. Imagine trying to sleep with your big toe throbbing in pain, so intense it feels like someone is stabbing it with a hot needle. That's the reality for people suffering from gout, a form of arthritis that often strikes at night, stealing both sleep and peace. Gout occurs when uric acid builds up in your blood and forms sharp, needle-like crystals in your joints. These crystals cause sudden, severe pain, tenderness, redness, warmth, and swelling. The big toe is most commonly affected, but gout can occur in any joint, including ankles, knees, elbows, wrists, and fingers. A groundbreaking 2024 study published in the British Journal of Hospital Medicine revealed something remarkable about sodium bicarbonate's effect on gout. Researchers found that when patients took sodium bicarbonate, combined with a medication called benzbromarone, they experienced significant reductions in serum uric acid levels and fewer uric acid crystal deposits compared to control groups. Here's how it works. Sodium bicarbonate alkalizes your urine, increasing the solubility of uric acid. This makes it easier for your body to dissolve and excrete uric acid, preventing the formation of new crystals and potentially helping dissolve existing ones. The study showed that patients taking this combination had better uric acid excretion and improved kidney function. Many gout sufferers report that taking baking soda water before bed provides relief during those critical nighttime hours when attacks often worsen. The alkalizing effect works throughout the night, helping to maintain a more balanced pH in the body and reducing the likelihood of crystal formation. 5. pH balance. After a long day, your body's internal chemistry often becomes slightly more acidic due to stress, diet, and daily activities. This shift might seem minor, but maintaining balanced pH levels is crucial for optimal cellular function and overall health. Your body has several systems that work constantly to maintain proper pH balance. Your lungs, kidneys, and buffer systems all play important roles. However, these systems can become overwhelmed by modern diets high in acid-forming foods like processed items, certain meats, and sugars. A recent 2024 study published in the Journal of Nutritional Biochemistry explored how consuming bicarbonate-rich mineral water affects this acid-base balance. Researchers found that participants who drank 1.5 to 2 liters of bicarbonate-rich water daily showed significant increases in urinary pH, making it more alkaline, and notable reductions in net acid excretion. What does this mean in practical terms? When your body doesn't have to work as hard to maintain proper pH, it can redirect that energy to other important functions like cell repair and immune system support. Drinking baking soda water before bed provides your body with additional buffering capacity during sleep, a time when your body naturally focuses on repair and restoration. This supplemental bicarbonate helps neutralize acids that accumulate throughout the day, potentially reducing the workload on your kidneys and other buffering systems. Many people report waking up feeling more refreshed and less achy after incorporating this simple nighttime ritual into their routine, likely due to the improved acid-base balance throughout their body. 6. UTI Management. As evening falls and the day winds down, the discomfort of a urinary tract infection, UTI, often intensifies. The burning sensation during urination, the frequent urgent trips to the bathroom, and that constant pressure in your lower abdomen can make restful sleep nearly impossible. UTIs typically occur when bacteria enter and multiply in the urinary tract. These bacteria thrive in acidic environments, which is partly why urination becomes so painful. The acidic urine passing over inflamed tissue causes that characteristic burning sensation. Sodium bicarbonate offers relief by changing the pH environment of your urinary tract. By drinking baking soda water, you can elevate your urinary pH, creating a less hospitable environment for the bacteria while also reducing the burning sensation during urination. A significant study published in the International Urogynecology Journal explored this concept directly. The research focused on female patients suffering from lower urinary tract symptoms who had acidic urine. After taking oral sodium bicarbonate supplements, participants experienced a remarkable increase in urine pH, from an average of 5.31, quite acidic, to 7.2, neutral. This pH shift correlated with significant improvements in symptoms. Patients reported notable reductions in urinary frequency, urgency, and nocturia, nighttime urination. Many participants found they could finally sleep through the night without multiple bathroom trips. Taking baking soda water before bed can be particularly helpful since UTI symptoms often worsen at night. The alkalizing effect works throughout your sleep hours, potentially providing extended relief when you need it most. 7. Cancer therapy potential. Recent scientific research has opened an intriguing window into how something as simple as sodium bicarbonate might play a supporting role in cancer treatment. A groundbreaking 2024 study published in Frontiers in Oncology examined how baking soda affects the environment around tumors. Cancer cells create a uniquely acidic environment around themselves. This acidity helps tumors grow, spread, and resist treatment. The research revealed that sodium bicarbonate can neutralize this acidic environment, potentially making it harder for cancer cells to thrive. In the study, researchers observed mice with malignant ascites, fluid buildup due to cancer. The animals treated with sodium bicarbonate solutions showed significantly extended survival rates compared to untreated control groups. The bicarbonate effectively neutralized the acidic environment surrounding their tumors. Perhaps most compelling was a detailed case study within the research. A patient with chemotherapy-resistant ovarian cancer received sodium bicarbonate treatment alongside standard care. Doctors documented a significant reduction in tumor markers and acidic fluid accumulation. The treatment appeared to make the tumor microenvironment less hospitable for cancer cell growth and spread. While these findings are promising, they're still preliminary. Sodium bicarbonate isn't a standalone cancer treatment, but rather a potential supportive therapy that might enhance conventional treatments by creating conditions less favorable to cancer cells. For anyone considering this approach, it's absolutely essential to consult with oncologists and healthcare providers rather than self-administering. The dosages and timing used in clinical settings are carefully monitored and controlled. 8. Rheumatoid arthritis relief. Rheumatoid arthritis, RA, affects millions worldwide, causing joint pain that can be especially intense at night. Unlike regular arthritis caused by wear and tear, RA is an autoimmune condition where your immune system mistakenly attacks your own joint tissues. In RA, the immune system sends inflammatory cells to the joints, causing the joint lining to thicken and resulting in pain, swelling, and eventual joint damage, while conventional treatments focus on suppressing the immune response. Research suggests baking soda might offer a complementary approach. A fascinating study published in the Journal of Immunology revealed an unexpected connection between sodium bicarbonate and immune response. Researchers discovered that consuming baking soda led to a remarkable shift in the spleen's macrophage population, from pro-inflammatory M1 cells, which drive inflammation, to anti-inflammatory M2 cells, which help reduce inflammation. This shift creates a more anti-inflammatory environment throughout the body. For RA patients, this could mean reduced joint inflammation, less pain, and improved mobility. Many people with RA report that taking baking soda water before bed helps them wake with less morning stiffness, a hallmark symptom of the condition. The nighttime dosing allows the anti-inflammatory effects to work during sleep when the body naturally focuses on repair. The study suggests that sodium bicarbonate may trigger mesothelial cells, which line body cavities, to signal to inflammatory cells that there's no threat, essentially telling the immune system to stand down. This could explain why something so simple might help with such a complex condition. Proper usage guide. For maximum benefit and safety, timing, dosage, and duration all matter when using baking soda water. The ideal time to drink baking soda water is 1 to 2 hours after your last meal, right before bed. This timing allows your stomach to settle from digestion and helps the bicarbonate work throughout the night when your body naturally focuses on repair and restoration. Proper dosage is crucial. Mix half a teaspoon, about 2.5 grams, of baking soda in 6 to 8 ounces of cold or room temperature water. Stir until completely dissolved and sip slowly rather than gulping it down. For specific conditions like inflammation or arthritis, give it at least 2 weeks of consistent alternate day use to notice potential benefits. Don't use it daily long-term without medical supervision due to sodium content. For general wellness support, using baking soda water just 1 to 2 times per week is sufficient and much safer for long-term use. This provides the benefits while minimizing any risk of electrolyte imbalance. Never use baking soda water on a full stomach, as it can cause bloating or even stomach rupture in extreme cases. If you experience any unusual symptoms like nausea, vomiting, or stomach pain, discontinue use immediately. Warnings and contraindications. Before trying baking soda water, be aware that it's not safe for everyone. People with high blood pressure should exercise caution as baking soda contains significant sodium, which can raise blood pressure or worsen heart conditions. If you take medications like diuretics, corticosteroids, or antacids, baking soda can interfere with their effectiveness or cause unwanted interactions. Always consult your doctor if you're on any prescription medications. Pregnant women should avoid using baking soda as a remedy without medical approval, as it can cause fluid retention and affect blood pressure during pregnancy. Those with digestive sensitivities may experience bloating or gas from baking soda. When it reacts with stomach acid, it releases carbon dioxide gas, which can cause discomfort in sensitive individuals. People with heart disease, especially congestive heart failure, should avoid baking soda supplements. The added sodium increases fluid retention and can put extra strain on an already compromised heart. Taking too much baking soda can lead to alkalosis, a dangerous condition where your blood becomes too alkaline, causing muscle twitching, irritability, and in severe cases, seizures. If you have kidney problems, the excess sodium can worsen your condition by causing fluid retention and increasing blood pressure. Always start with small amounts and stop immediately if you experience any adverse reactions. That's it. If this video helped you, hit that like button and leave a yes in the comments. Your experience could help others struggling with similar issues. Subscribe now for more science-backed health tips that big companies don't want you to know. Take care of your health naturally. Remember to consult with a healthcare professional before trying any new health remedy,